Hi, welcome to this episode of Detroit Peds Talk. I'm Dr. Jameel Smith, lead integrative behavioral health pediatric psychologist at Wayne Pediatrics and clinical assistant professor at the Wayne State Department of Pediatrics in the School of Medicine. October is Depression and Health Screening Month. At Wayne Pediatrics, mental health is always a focus of ours. So we wanted to share some information about how we help our patients and their parents support their kids showing symptoms of depression or just struggling with low mood. And to discuss this topic, I'm so excited to have my colleague, adolescent pediatrician, Dr. Sharon Marshall, with us today. Welcome, Dr. Marshall.
Yes, and thanks for inviting me. This is such an important talk and timely topic for parents to discuss with their kids.
Absolutely. So, how is depression screening implemented at our clinic? How do you sort of screen for some of these symptoms?
Well, especially when patients come in and they don't let us know ahead of time that they're having these kinds of problems. Maybe they're scheduled for just their annual yearly checkup with the doctor. We have parents fill out a questionnaire that looks at family history and any concerns. So the parent could write it down on that form that I'm concerned because my child seems very negative or is always upset or angry or irritable. We also give questionnaires to the patients to look at their mood. So it will ask them questions specifically about, have they felt sad or isolated for the last 2 weeks? Have they had any thoughts of harming themselves? And so we give the patients the questionnaires to fill out, and then we go over it with them. And if there are concerning issues, we always let them know that we need to discuss this with your parents.
Mm-hmm. Yeah, one of the things I think is so important about what you're describing is this whole family approach, right? So we're trying to include the parent because they're the parent, but we're also interested in how the young person is experiencing their life and situations. So what do we do? If you could describe a little bit about how we determine if our patients are experiencing signs of depression, right? So they fill out a form, but what do we do from there?
Well, we really go over it because a lot of times patients don't feel comfortable writing down their real feelings. So I will go over it with them and let them know that the reason why we're asking these questions is to make sure that we can help you if you're having any difficulties with school or family or relationships, if there's substance abuse issues going on. Ask them about their sleep. And then we can use some questionnaires that have a scoring mechanism to look for kids that are mildly depressed or kids that are more severely depressed, because treatment or how we would manage this would be very different.
Yeah. Speak to how do we support our patients who might describe that they are experiencing some of these symptoms?
Well, I try to let patients know, and I think now, it's on the internet, it's on social media, it's on television, that not only adults, but kids have had depression, feeling sad, feeling anxious, worried, and this has gotten a lot worse after the pandemic. And some public schools have even had programs about improving mental health. So it's discussed more now than it was 20 years ago. So, if I ask patients, have you been feeling sad or depressed? They usually know what you're asking. As opposed to 20 years ago, I think teenagers would be kind of unsure. But, and I let them know that, I'm not trying to pry or get in your business, but these are important questions because young people often will keep this a secret or not tell anyone because they're embarrassed. They don't want to let people know that they can't cope. They're not, not man enough to get through their day. And so there's a lot of stigma attached to mental illness.
Mhm.
And, it's okay to have pneumonia But to have depression or anxiety is still looked upon by some people in our society as you failed or you couldn't do it or there's something wrong with you. So you want to let young people know and families that the reason why we ask these questions, because these are common things that kids may experience, and that we can do something about it and to normalize it so that they don't feel like they're the only person in Detroit who's struggling with this and that somehow it's their fault or they're a failure because they have these feelings.
Yeah.
And we try to get them to see that this is a process and we will help them through it and that they won't feel like this forever.
Yeah. Yeah. It's so important what you're talking about, normalizing this so that we are addressing the stigma and just inviting parents and young people to open up about what they're experiencing. I know here at Wayne Pediatrics, we have a team that will, come into the room and support all of what you're doing and trying to talk to and support the family and the young person. Perhaps connecting them with a therapist, maybe I might see them or another therapist in the community. Sometimes we even come into the room and provide an intervention right then and there
Yeah,
so
yes.
that they have some short-term support for managing those symptoms. Talk a little bit about how you decide sometimes maybe to offer medication.
Well, it depends on how they're feeling and how long they've been feeling that way. Sometimes some kids may have kept it from their families for several months, and maybe parents were just noticing some, significant changes in behavior. School is starting, maybe they're just can't get out of bed in the morning. They just are feeling really down. They aren't motivated. They used to be on the football team and now they're missing practice. They don't really want to go. So, looking at things like that, if they've had changes in the way they're feeling, if they aren't enjoying things like football or being singing in the choir anymore, and if it's been going on for a fairly long time, finding out what their day-to-day life is, do they have any joy moments? Are they enjoying school or football or cheer? Because oftentimes they can say that, after my grandmother died, I noticed that I was feeling down and I just the feeling didn't go away. So looking at how long it's been going on, the severity of the problem, it's depression can manifest itself in different ways in different people. So some kids may lose a lot of weight. Some kids may gain a lot of weight from their baseline. Sleeping, some kids can't sleep at all. They keep waking up every 20 minutes. And then other kids are just sleeping for 6 and 8 hours and still feeling really tired. So going through their day-to-day activities, finding out things that have changed. And it's also really important to talk to the young person alone because oftentimes they don't want to burden their families, or maybe sometimes it's family issues that kids are struggling with. And it's easier to tell someone else than it is to discuss it with a family member. And then ask them how bad they feel, or how many happy days have they had in the last couple of weeks. And kids that are very down or very negative about themselves and don't feel hopeful for the future, you have to ask about, have they thought about hurting themselves? Have they thought about, ending their life? Because kids read about suicide in social media. They may have known someone at their school or perhaps a friend who attempted suicide, committed suicide, was hospitalized for those things. So you have to ask, have they thought about them?
Yeah. Yeah. I'm glad you raised that. Sometimes parents, or just people in general, think that asking a young person, clearly, have you thought about hurting yourself or committing suicide, that in some ways that might encourage them to act upon that. But in actuality, what it does is it provides space for them to unload
Yes.
sometimes what feels like a big, big burden if they're struggling. And so I often encourage parents to ask the question explicitly. I noticed that you're struggling. You've changed a lot of things. You're not talking to friends or whatever the case may be. Are you thinking about hurting yourself or committing suicide?
Yes, it's important to acknowledge that and ask kids that question because, teenagers are, they're developing lives of their own. They may not share that with the family. And parents may think they're struggling a little bit, but maybe, every day is really a struggle and they can barely make it.
Mm-hmm. Mm-hmm. Well, you know, we wanted to let parents know that this is a common issue and to reach out to Wayne Pediatrics for help. We can assist with this. And if we're unable to accommodate, or support, there are other resources that we can make available, to support the family and the young person. It's important to remember addressing your child's mental health as soon as you notice symptoms can help them develop healthy coping skills that can benefit them for their entire life and make them feel better in the process. For more information or to make an appointment with Wayne Pediatrics, your one-stop pediatric practice, please visit waynepediatrics.org. Also, follow us on Instagram, Facebook, and YouTube for new Detroit Peach Talk postings every first Wednesday of the month. And remember, pediatricians are the best option for the medical needs of children. Thank you so much, Dr. Marshall.
Thank
We
you.
appreciate you. Take care.
Bye-bye.